Thank you for the opportunity to present our work today. I have nothing to disclose. Structural violence and racism shaped many neighborhoods, and this impacts health through social determinants, which are a major driver of health outcomes. San Francisco, with a population of 850,000, has an overall life expectancy of 83 years, but this varies widely at the neighborhood level. To explore this disparity and its drivers, we sought to examine premature deaths and area-based social factors at the neighborhood level. We hypothesized that populations living in socially disadvantaged neighborhoods shoulder a disproportionate burden of deaths across generations, especially those due to chronic disease and violence. And these same neighborhoods are those that were impacted by historical discriminatory policies. We used data for the top 20 causes of premature death and homicide provided by the San Francisco Department of Public Health, including years of life lost and age-adjusted years of life lost calculations. We also used census 5-year estimates for the listed variables. We perform univariable linear regression between neighborhood social factors and causes of death. 38 neighborhoods were included in this study. Top causes of death were ischemic heart disease, lung cancer, and strokes, seen on the left of this box plot of medians and IQRs. Many of the neighborhoods that were routinely high outliers for AYLLs were also socially underserved. Based on univariable analysis, a neighborhood's adjusted years of life loss burden for most causes of death tended to rise, as indicated by the blue color, with increasing percent population male, Black, unemployed, less than high school education, and percent below poverty level. And a neighborhood's percent population Black, a marker of discrimination based on redlining, was associated with the largest increase in AYLL for deaths from all causes, and those specifically due to chronic disease and homicide. This image juxtaposes the present-day neighborhoods most burdened by deaths due to homicide, chronic disease, and all causes in yellow, and historical racist redlining in red. Of note, these two neighborhoods were sparsely inhabited and not graded. The same neighborhoods with a high burden of AYLLs across most causes of death, indicated by blue, had high percent population Black and high percent population below poverty level, indicated by dark red. There is a mortality inequity burdening people living in socially disadvantaged San Francisco neighborhoods, and many of these inequities align with areas subjected to historical discriminatory policies. Multiple generations are affected, and this creates a lack of wealth health trap that is difficult to overcome. Next steps include collecting more data at both the individual and group level, implementing trauma-informed care, performing qualitative studies with community participation, investing in these socially disadvantaged neighborhoods, advocating and eradicating discriminatory policies and practices. Thank you.